Thank you both for your talk. I enjoyed it immensely, Dr. Day and Dean Sossin, and thanks to the Constitution Foundation for having this. I wanted to challenge you. You said it's ideological, it's faith-based. I think it's fairly reasonable to take faith in evidence. And so I'm pushing back a bit on something you've said at least 3 times now, Dean Sossin, that we just have to take it on faith that this is the right thing to do. It's the morally correct way to support a universal system. Well, actually, the literature is quite clear that in our so-called universal system, a person of low socioeconomic status accessing the identical care and service as someone from a higher socioeconomic status will wait longer and have much more difficulty accessing that service and care. So that's settled, that's a fact. The evidence is there, and I can get you many papers to show that. So we do not have the moral high ground in our current so-called universal system. And on top of that, many European systems that have a blended approach have again shown conclusively that those of the most disadvantaged economic classes in society have much better access to life-saving and preventative medical treatment and therapy than we provide in our country. So actually, blended healthcare systems improve access and care for those who need it most. So I would challenge you, and I look forward to your comments, to stop saying that we have the moral high ground by throwing around the word universal care. We do not. We are letting down our most disadvantaged people in our society right now, and we can no longer throw around the word universal care as a prop for a system that is disadvantaging our most needy patients in our society.
No, I appreciate the comment, and in fact, if I've come across as an adherent, I should clarify, I'm an agnostic. What I'm asserting is that the governments who've put in place the system we have, both federally with the spending power underlying its vision of universality, and then provincially in terms of the actual legislation that gets challenged that prevents seeking private health insurance, that it's justified, I think, as an article of faith about universality, to which I believe it ought to be subject to the rigors of evidence and scrutiny and review.